the uncomfortable question with a crucial answer for many men. The topic of prostate exams is often met with discomfort, apprehension, or even avoidance. It's a subject shrouded in myths and sometimes dismissed as an unnecessary intrusion. Yet behind this discomfort lies a critical question. Are prostate exams truly necessary? The answer, unequivocally, is yes, especially when considering the silent threat of prostate cancer and other prostate-related conditions. This article will delve into why these exams are vital, who should get them, what they entail, and how they empower men to take control of their prostate health. Why prostate exams are indispensable? The power of early detection. The primary reason prostate exams are considered necessary stems from the fact that prostate cancer is often asymptomatic in its early, most treatable stages. Unlike some other cancers that present clear symptoms early on, prostate cancer can grow silently for years. By the time symptoms like difficulty urinating, blood in urine, or bone pain appear, the cancer may have advanced, making treatment more complex and less effective. Early detection saves lives. Regular screening significantly increases the likelihood of detecting prostate cancer when it is still localized. At this stage, treatment options are abundant, and the chances of a cure are very high. Monitoring other prostate conditions. Beyond cancer? Prostate exams can also help monitor or detect other common prostate issues, such as benign prostatic hyperplasia or prostatitis, even if these are not directly cancerous. While not life-threatening, these conditions can significantly impact quality of life. Informed decision-making. Screening provides valuable information that, in conjunction with other health data, allows men and their doctors to make informed decisions about personalized health management and potential interventions. Who needs a prostate exam? Understanding the guidelines? Guidelines for prostate cancer screening can vary slightly between medical organizations. But generally, key factors include age, family history, and ethnic background. Average risk. For men with an average risk of prostate cancer, discussions about screening typically begin at age 50. This includes a digital rectal exam and a prostate-specific antigen blood test. High risk, age 40 to 45. Men with a family history of prostate cancer or African American men should begin discussions about screening much earlier. Multiple first-degree relatives. If multiple close relatives had prostate cancer at an early age, screening might start even earlier. Discussion with your doctor. It's crucial to emphasize that screening decisions are not one-size-fits. A shared decision-making process with your doctor is highly recommended. This involves discussing your individual risk factors, personal values, and preferences regarding the potential benefits and harms of screening. What do prostate exams entail? Demystifying the process. The prostate exam typically refers to two main components. 1. Digital rectal exam. The procedure. During a DRE, your doctor will gently insert a lubricated, gloved finger into your rectum. They will then feel the prostate gland, which is located just in front of the rectum. The exam is quick, usually lasting only a few seconds. What the doctor checks for. The doctor is feeling for any abnormalities in the prostate size, shape, texture, and consistency. They can detect hard areas, lumps, or nodules that might indicate a problem. Sensations. While often perceived as uncomfortable or embarrassing, the DRE is usually not painful. You might feel pressure or a brief urge to urinate. It's important to relax as much as possible to facilitate the exam. 2. Prostate-specific antigen blood test. The procedure. This is a simple blood test that measures the level of PSA, a protein produced by prostate cells, in your blood. What PSA indicates. Elevated PSA levels can indicate various prostate conditions, including prostate cancer, benign prostatic hyperplasia, or prostatitis. A higher PSA level doesn't automatically mean cancer, but it does warrant further investigation. Limitations. PSA levels can fluctuate due to many factors, making it not a perfect indicator. That's why it's often used in conjunction with DRE and other factors. Beyond the basics, modern approaches to prostate screening, while DRE and PSA remain the cornerstones of initial screening. Advancements in medicine are refining the process. PSA velocity and density. Doctors may look at the rate of PSA increase over time. or PSA concentration relative to prostate volume for a more nuanced assessment. Free PSA and PSA isoforms. Further tests can differentiate between types of PSA, offering more insights. MRI scans. Multiparametric MRI is increasingly used before a biopsy or as a follow-up to suspicious PSA levels. It can provide detailed images of the prostate, helping to identify suspicious areas and reduce the need for unnecessary biopsies. Genetic testing. For men with a strong family history, genetic counseling and testing for specific gene mutations might be considered. These can increase prostate cancer risk. Risk calculators. Online tools use multiple factors to estimate an individual's prostate cancer risk. Addressing common concerns and dispelling myths. Prostate exams are always painful or embarrassing. Reality, while potentially uncomfortable or awkward for a moment, DREs are rarely painful and are performed by professionals accustomed to this sensitive procedure. The benefit of early detection far outweighs any brief embarrassment. Myth: if my PSA is normal, I don't need to worry. Reality: while a normal PSA is reassuring, it's not foolproof. Some aggressive cancers can occur with low PSA, and other factors are also crucial. Myth: screening leads to overtreatment. Reality: this is a valid concern, and discussions around active surveillance for Larissa's cancers have become more prominent. The goal of screening is early detection, which then leads to informed decision-making about the best course of action, not necessarily immediate aggressive treatment. Empowering men through proactive health. Prostate exams, encompassing both the digital rectal exam and the PSA blood test, are unequivocally necessary components of proactive male health. They serve as vital early warning systems, particularly for prostate cancer, which thrives on silence. By understanding the rationale behind these screenings, knowing when to start them and what to expect, men can overcome apprehension and embrace these simple yet powerful tools. A conversation with your healthcare provider is the most crucial step. Discuss your personal risk factors, family history, and any concerns you might have. Making an informed decision to undergo regular prostate screenings is an act of self-care and a commitment to safeguarding your future well-being. Don't let discomfort or misinformation deter you from a potentially life-saving step.